Hi, Sandy. Thank you so much for agreeing to be our expert speaker
No problem.
on collective bargaining. And so we'll go ahead and get started with the interview. What are three gains for staff nurses in California that would not have been possible without UNAC involvement?
Well, the main one is the DHS nurse to patient ratios. That is that's extremely important for nurses. It controls how safely we practice.
Right.
And without the assistance and the push from the unions, we wouldn't have had that, because the hospital and medical organizations had fought very heavily not to have nurse-to-patient ratios.
And that's one that has impacted the entire state, correct?
Correct.
Okay.
And inadvertently other states, because other states do strive to have what California has,
Right.
which are the protective laws.
Awesome. Okay. And any other gains that you can think of?
Well, there's been multiple ones. All of the safety measures are usually backed by the unions, which is the needle sticks, the lift teams.
Okay.
Anything that you can see that is related to patient safety is usually either backed by the unions, or the unions are at the forefront and are the ones that have pushed to have something come together.
Awesome. Okay. How has UNAC activity influenced the benefited non-union hospitals?
Well, inadvertently you carry with you whatever benefits you get, you increase the community standards.
Okay.
So if your facility has high pay, high health benefits, inadvertently to keep up, the other community hospitals, whether or not they're unionized or not, will also come up to that standard. So inadvertently you help not only nurses, but
Right.
management too, because
Okay.
they have to match it.
Right.
So it keeps everybody at a good level.
Okay. All right. So that's definitely beneficial for the bedside nurses. How are decisions typically made within a union when there are opposing positions among the members?
Well, it's a democratic process, and it's a tiered system. You have the affiliate level, which is a local union.
Okay.
For instance, us, we're St. Francis Registered Nurse Association, but we're one affiliate of many under UNAC UHCP, the
Okay.
United Nurses Association of California.
Okay.
And UNAC UHP is participates in a national union.
Okay.
So you have the national level that has its rules and regulations, and then they govern UNAC, which then governs all the affiliates.
Okay.
And then you have the UNAC regulations, which governs UNAC and all the affiliates. And then you have the local.
Okay.
At the local level, it's primarily the 4 officers that make the decision. But anything that affects the what we have close to 800 nurses now, is a democratic process. You
Okay.
present it and it's voted. If the general census is that it's something that they want, then it passes, and if not, then it doesn't pass.
So with the 800 nurses here at your facility, do you look for a particular number or percentage when you take a vote?
It has to be majority vote.
Okay,
Whoever voted the majority of that vote.
I got you. Okay, all right. For nursing, what are the consequences of not having a collective bargaining agreement?
Well, you don't have this strength. And in nursing, I think the dynamic that hurts nursing, that is a good thing, but it hurts nursing, is the codependency that nursing has, which is the desire to do good, but a lot of times you give away what you've worked really hard for, which is, a lot of it is respect.
Right.
And to get paid for what you're doing. And, the nurse is the one that's at the bedside 24/7.
Right.
The nurse is the one that's interacting with the families, and the nurse is the first one. If the nurse can't tell that there's something wrong with the patient, by the time the doctor gets here, the patient isn't going to be doing very well.
Right.
And without collective bargaining, most nurses aren't going to stand up and say, we should be paid for what we're worth.
Right.
We should receive the benefits for what we're worth.
Okay.
And we should receive the respect for what we're worth.
Okay.
You know, so it does help, and inadvertently it helps other facilities the same way.
Right.
Because if you have, in a community, if you have a standard in one hospital, the other hospitals are gonna have to at least kind of meet that same standard.
Makes sense. Okay. What advice would you give to nurse leaders to facilitate building collaborative relationships with the nursing unions?
Well, I think first of all, management tends to take the stance that the union is the enemy.
Mm-hmm.
And I think that's the first barrier.
Mm-hmm.
Throughout my years, I've noticed that I can go into meetings and, you know, the environment is extremely hostile.
Mm-hmm.
And I come out of the meetings and, you know, people take it very personal and the environment remains hostile. I try to make it a practice that, you know, you do what you have to do in a meeting, and afterwards you don't have to be hostile towards one another, and you can continue to communicate.
Right.
And management tends to take the stance that it's an enemy situation,
Mm-hmm.
instead of communicating with the unions and trying to collaborate. There's always gonna be disagreements,
Right.
but usually you can get to a place where both needs are being met, if that's the attitude that people go in with it.
Right.
You know, you're not gonna get 100%, I'm not gonna get 100%, but we're gonna get something that works for both of us
Mm-hmm.
and benefits the patient.
Well, hopefully, this video will help to facilitate that with the nursing leaders that are actually going to witness this and hopefully take some note. What effects do you think that the Affordable Care Act could potentially have on union members?
Well, I think it's, it could be good and it can be bad. You know, there's more insured patients, so you'll have, hopefully, the hospital's not suffering as much. You know, we do have a lot of uninsured and non-paying, especially in a facility like we have,
Right.
because of the area that we serve,
Right.
and because we're a trauma center, we do have a lot of uninsured. So at least some of the money will be coming back, and then they'll be able to put it back into the facility.
Mm-hmm.
I think that the hospitals are trying to do more with less,
Mm-hmm.
and because administration is so afraid that they're not going to be reimbursed, there is a big push to have nurses do a lot more. And it's very stressful.
Right.
So on the one hand, for the patients, I think it's really good,
Mm-hmm.
but on the other hand, I see an increased level of stress to the nurses.
And that's unfortunate.
Yeah.
Okay. Well, that's all the questions that I have. I really, really appreciate your time and your input. And like I said, the ultimate objective for us is, particularly with our group in filming this, is to try to facilitate that collaborative relationship and to dispel the adversarial us against them type of relationship that exists in some of the hospitals.
Well, I mean, when we collaborate, we're able to do really good things. You know, recently we're becoming a stroke center, and we had to have mandatory classes. And together with the push from both sides, we had, out of the 700, 98%
Oh,
complete
wow.
everything that they needed to complete.
Oh, that's impressive.
You know, but it was very collaborative.
Right.
You know, memos came out from both sides and
Mhm.
communication from both sides, so it was a wonderful turnout. So when we work together, it works really well. When we're very opposed, then it can be difficult.
Exactly. Okay. But thank you for your time.
Thank you.